Hi, I'm Dr. Shiji Chalipat, Consultant Pediatric Neurologist at Ankura Hospital, Pune. Today I'm going to talk about Autism Spectrum Disorder in children. So what is this autism? So this is a neurodevelopmental disorder in which children can have difficulty in communication, socialization, as well as some behavioral problems. The word spectrum means it is associated with varied symptomatology and the severity varies from children to children. Some kids can have mild autism, some kids can have moderate, and some can have severe autism. Now let's see what causes this autism. So the exact etiology, the reason is not yet known and it is still under research, but genetics plays a major role and some part is played by the environmental factors. There was a big news of vaccination and the autism long back, especially the MMR vaccination. And the research has proven that there is no evidence of causation of autism after this vaccination. So please don't worry about it. Now let's see what are the red flags, means the early symptomatology of autism, how you can identify the symptoms. So if your child has a speech delay, if your child has a poor eye contact, not following your instructions, especially not responding when you call them by their name, and they seems deaf even though they have a normal hearing. They might have some repetitive behaviors like hand flapping, foot tapping, toe walking. Sometimes they will play with the same toy in the same manner again and again. They like spinning things, so they might play with the wheels of cars, spinning them continuously without playing exactly with the car. Some kids will have sensory issues as well. What are the sensory issues? So this is the high sensitivity to loud noise or a bright light, or sometimes with the smell or some textures. So when you have your kid having these symptoms, please consult your doctor immediately. So whom should you consult? So the doctor can be your pediatrician or a developmental pediatrician or pediatric neurologist. So after this consultation, a definite screening tools will be used and the confirmation of diagnosis will be done and some necessary investigations will be executed. So after the consultation, your doctor might suggest some blood investigations, sometimes MRI brain, EEG if your child has a seizure, or some genetic testing if required. So this is for the confirmation of the cause for the autism. Now coming to the treatment plan. So in the treatment, it includes mainly the therapy as well as some medications and sometimes with a dietary change. What does this therapy include? So it includes speech therapy, occupational therapy along with sensory integration, behavioral therapy, and some kids might need the special education therapy at school level. So the main thing you need to remember is always treat them with care. Provide a calm environment at home to decrease their sensory issues and appreciate their strength. Identify their strength because some of these kids are extremely talented with their memory, math skills, or in their art or music. So these can be the future genius or famous people if you encourage that strength. So together we can treat them. Even though it is not a curable condition, we can definitely treat their symptoms if you start the treatment at an early stage. So earlier the treatment, better the outcome. If you have any doubts or concerns, please reach out to us on the following number or email ID and we are there to help you. Thank you.